Hello, this is Angelia, and you're listening to or watching the podcast, Why You Do What You Do. The podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. We were talking about some abnormal psychology, and we're going to start now talking about positive mental health. Perhaps it seems strange to talk about positive mental health when looking at abnormal behavior. The definition of abnormal depends pretty much on the definition of normal. Sorry about that, telemarketers. Oh, I know I was one for 12 years, and I know. But still, don't be interrupting my day. Anyway, the definition of abnormal depends pretty much on the definition of normal, that is healthy. We have also shown the societal definitions of normal and healthy are constantly changing. Because as we learn more, we learn what is more or less a normal thing or an abnormal thing. So it is almost as difficult to get a satisfactory definition of positive mental health as it is to define abnormal behavior. Because what one person thinks is good, another person might think is bad. Nevertheless, several theorists have tried to establish exact standards for the positive end of the continuum. Most of them agreeing that there are several necessary criteria, but agreeing less on just what the criteria are, like, most people on most things. Jehoda, for instance, offers 6. Number 1, awareness, acceptance, and correctness of self-concept. Number 2, mastery of the environment and adequacy in meeting the demands of life. Number 3, integration and unity of personality. Number 4, autonomy and self-reliance. Number 5, perception of reality and social sensitivity. Number 6, continued growth towards self-actualization. So that's what he felt like was the important things towards mental health. Of course, awareness, you need to be aware of what's going on around you. Acceptance, there are people who, put the blockade up and they can't accept what's going on, and that's not acceptance, is it? No. Correctness of self-concept. There are people who have grandiose opinions of themselves. There are people who have very low opinions of themselves. So you should be somewhere in the middle with the correctness of your self-concept. Mastery of the environment. You are in an environment, we all are, and you have to be able to master that. I've had to adapt things around here to make them work for me, because I can't do a lot of things I used to do, but I've found ways to do them that work for me. And adequacy in meeting the demands of life. Life is going to happen to you. You need to be able to rise to the occasion and do what needs doing. The integration and unity. Oh my gosh, I'm trying to sneeze. Unity of your personality. You shouldn't be divided a lot in, there are people who I call chameleons. I had an ex-boyfriend who was a chameleon. He was different ways with different people. There was no continuity of personality. And I found it to be a little disturbing and off-putting. But some people are like that. But it's healthy if you're integrated and have a unity of personality. You're the same with, everyone. Now, there are people you hang around with for this, that, and the other thing, these friends. But again, you should be the same you across the board. Autonomy and self-reliance, you should be relying on yourself as much as possible. There are people who are disabled or, for whatever reason, who can't support themselves financially, but they can support themselves in other ways. They're getting themselves up, they're doing their thing, and, they're contributing something to the world. Their perception of reality, again, you live in a reality. You have to be able to perceive that it is the reality. If you're making up your own, and you're having hallucinations and things, that's not good. And social sensitivity. That is not in vogue here in the USA right now, but that is one of the things that are considered to be mentally healthy, as if you are sensitive towards others. You care about others. So that's something you need to think about. Continuing growth towards self-actualization. Like I said, you should never stop learning. You should never stop growing. Till the day you die, I forget who we were reading a story about, and then their last breath, they're like, oh, I think I'm starting to see, and then they die. So, you should always be growing and learning and becoming your best self. According to this theory, a mentally healthy person should have a high degree of each characteristic. One or more deficiencies would indicate some degree of abnormality. And, all of us have some degree of abnormality at one time or another. Some of us have had low self-esteem, low self-confidence. So that is not, to indicate that you are mentally ill or whatever. It's just, degree thing. Remember, we talked about the degrees. In a similar vein, Schwarz-Coleman sees positive mental health as a reflection of the unique human capacity for symbolization and social involvement. Social involvement. We're supposed to be social creatures. We're just like, the apes, birds, whoever you want to look at in nature. There are very few creatures who are very solitary. There are some, but in general, we're supposed to be socialized. We live in a society. Some people might not like that, but hey, we do. There is no frontier left. There really wasn't one when people thought there was one, because there were other people there that they wiped out to get that frontier. But anyway, I won't get on that soapbox. But, you should be involved socially with other people. Specifically, Schwarz-Coleman lists the aptitude for capitalizing on past experiences. You should be able to learn from things you've come through. You should be able to learn from your mistakes and your victories. That is something that is important. Self-control. Again, that's not so much in vogue here in the USA right now. But you're supposed to have self-control. Everything that comes in here isn't supposed to come out here. You're not supposed to be so impulsive that you act on every impulse that you have. Like my kids call them Karens and Kevins. We have way too many of those here going on right now. Y'all need to check yourselves before you wreck yourselves. The ability to envisage ideas. You should be able to imagine, if I want to do this thing, what would it look like? How would I go about it? You should be able to come up with ideas for your future goals. Social reliability. You should be able to be reliable to people. Now, there have been times where I told somebody I would do something or go somewhere, and something else came up. And I've been criticized once or twice. And it's like, but my son needed this, me to come for him, and my kids come first. Friends fall behind the kids. So, if any of my friends think I'm not a good friend because the kids come first, then you're not a good friend. Bye. But that's just the facts of life. And sometimes stuff happens. There's car trouble. There's, emergencies or whatever. So, sometimes you just can't do what you said you will do for people. But in general, you're supposed to be able to show up. You're supposed to be socially reliable. The capacity to act independently while still acknowledging the need for relationships with others. Now, I'm a very independent person. My husband and kids will tell you that. I can pretty much do anything I need to do or want to do. But now I acknowledge that he's paying the lion's share of things. I'm not making that much money. I got a trickle. I got a check the other day. I was happy. But, I know that, he's doing things, and my kids do things for me all the time. I can't physically get out and do yard work, so one of my sons does that. Another one of my sons takes out the garbage. Another one of my sons comes over and, picks up and organizes stuff every now and then. So, even though I'm a very independent person, I know that there are things I, need help with. And, I like, my family that I associate with. I like my friends, and I like other people that I've met throughout the years and had dealings with. I had a great neighbor across the street, and I had a pretty good neighbor next door. They've all moved on now. But, I'm a happy person, and I like people in general. So, you might not feel that way, and a loner is not a good thing to be, because someday you might need somebody and then there's nobody there because you've been alone. So, realize that relationships with others is a blessing in your life. It's important. And now we're going to talk about mental health professionals and the different kinds. In recent years, psychotherapy has become a rapidly expanding, diverse field that has given rise to a varied group of mental health entrepreneurs, or you could say professionals, but most of them are entrepreneurs, have their own offices, each vigorously supporting a particular technique or method. While residents of rural areas may simply turn to a friend, a family doctor, or a clergyman for advice, urban dwellers may be confronted by a confusing array of options. And now my husband's family is from the country, and there were some bad attitudes about mental health professionals for there. One of the problems we had in our previous marriage is he's like, oh, my wife's not going to be a head shrinker. My wife, no, I don't believe in them head shrinkers. Ain't nobody getting in my head. I don't believe in them people. And that was an attitude in his family. They thought they were full of it, and that was what they rather do. His mother had gone for counseling to a pastor. So sometimes people aren't as up on things as they need to be for their own good. Ranging from astrologers and masseurs. A massage feels good, it does, but they're not going to solve your mental health problems. They can give you advice just like your bartender, but they're not going to solve your mental health issues. To social workers and psychiatrists, that's a better option for you. Therapeutic approaches can be separated into three broad methods. Those that examine the root of current psychological problems, those that emphasize modifying behavior rather than analyzing its causes, and those that seek to enhance personal growth, improve interpersonal interactions, and increase one's sense of well-being. And that was my approach when I was doing life coaching. I was trying to make you a good, healthy, whole person, and see, there are a lot of folks who don't want to see how their behavior affects their relationships with others. And some folks, they have wounds, and those wounds make them exhibit behaviors, and those behaviors keep them from having relationships with others. So, sometimes people can be pretty stubborn and stuck in the victim mode, and you gotta, okay, if you were a victim, I'm sorry, stuff happened to you, stuff happened to me, but eventually you have to see that it's within your power to overcome that and get treatment and become a whole person. So that's where the line is there. Some people get stuck behind that line from moving forward, and they stay stuck. Often, practitioners combine various methods, but although techniques may overlap, it is important in choosing a therapist to clarify your own particular needs and to know the background and training of the professional you deal with. And that's why I put my stuff, when I had my pages, PhDE. I have an equivalency. It's not a doctorate. It's not a license. I got my education myself. Had to do it the hard way. Took me like 13 years. I had to do pay as you go because I couldn't afford to go to a local school, so therefore I couldn't get a license. But I got my education. I didn't, go through a program and get, all that stuff. But I have things on the wall over here that say I've got the equivalency of a doctorate in psychology, so that's what I got. And like I said, it was piecemeal, this school, that school, some self-education that I got credits for. So, but I got it because I wanted it, and that's the important thing. If you want something, you have to go out and get it. No one's going to put it in your lap. And, as they say, there's more than one way to skin a cat. If you can't find this way to do it, then you can look into other ways. We have this thing called Google. Google is just magical. You can put in anything, and it will find something for you and tell you how, you can start approaching your goals. So, you can do it if you want to. Psychiatrists are medical doctors who have special training, including several years of residency training in a psychiatric hospital in the diagnosis and treatment of mental disorders. And now psychiatrists are the ones who usually prescribe medication. So if you're going to need medication, a psychiatrist would be a good choice for you. They are licensed to prescribe medication and should be knowledgeable about mood-altering drugs and when to use them. Psychiatrists who specialize in Freudian theories and methods are often called psychoanalysts. And, bless old Freud's heart, he meant well, but everything doesn't go back to sex, honestly. And everything he said wasn't specifically about sex. That's a, caricature that people, have thrown up, so. In addition to their MD or PhD, they, have spent several years studying psychoanalytical techniques and receiving in-depth analysis themselves. So, if you think head shrinkers don't have to do a lot of work to get there, you're wrong. Most clinical psychologists have a PhD in psychology and have served a 1-year internship in a psychiatric hospital or mental health center. Training has been geared to the diagnosis and treatment of mental disorders. In addition to administering and interpreting psychological tests, they may also be active in research. Although counseling psychologists usually have a PhD in psychology, they tend to specialize in the treatment of problems that are not generally classified as mental disorders. For example, personal adjustment and marital conflict. And now we also have the licensed clinical counselors who do this. The professional social worker gains clinical experience in a mental health setting while earning a master's degree or doctorate. And when we say that, we mean clinical social workers. We don't mean the people at your neighborhood center who are just helping you get benefits. Those are, different type of social worker. Special training and interviewing and information gathering may lead the social worker to go beyond face-to-face discussions with the individual patient to treatment programs for the family and community. The psychiatric nurse is yet another mental health professional. The requirements for such a position are an RN plus specialized training in the handling and treatment of mental patients. People who need help should seek the expertise of the professional specializing in the area that applies to their specific problem. And again, like I said, there's Google, and you can say who would be the best mental health professional for this if it's something you think you have, and it can give you some ideas. And if the life crisis that impels them to seek help also clouds their decision-making ability, a good start might be a mental health or family service agent, a hotline, or a local hospital. Because I've met people who their presence of mind is just not there. They are just confused about what to do next. I don't know. What will I do? And it's like, go talk to somebody. That's what you need to do. Time commitment, money, and an infinity of temperament between therapist and patient are all important factors to consider. And that's true. When I got in my 20s, and I wanted to go talk to somebody, the first two people I talked to, no, that didn't work out so well. The one was specializing in PTSD, but he was seeing mostly veterans and things like that. And he admitted, he didn't have a lot of experience with what I asked, so he referred me to this other fella. And this other fella really turned me off. All he wanted to do was show me naked pictures, and it's like, to me, this goes against my religion. I understand what you're doing. But I'm not okay with what you're doing, because to me this is a sin. So I don't want to do this. And so he said, well, I know of this woman, and she has experience with this sort of thing, and so I'll refer you to her. And so I went to see her, and it was a fit. So you might have to try several times before you find the one that fits. But just don't quit, because the outcome will be you being, mentally well adjusted. So that's what you need to do. And she was really good for me. She had experienced some things herself. I went to her for a couple of years, and then I was in some groups for a couple of years, and it did me a lot of good. So, I can highly recommend therapy and groups. If you stick with it, it'll, work out for you in the end. You'll come out a more happy, well-adjusted person. Unfortunately, there is no magic cure, and many therapists and clients agree that the most effective treatment is the one that works best for the individual involved. And that's because everybody's different, everybody's unique, and there is no such thing as one size fits all in psychology. Since definitions of a positive mental health are extremely difficult to apply to particular behaviors, there is no reliable way to measure how much positive mental health an individual demonstrates at any given time. Researchers do agree, however, that good mental health is more than just freedom from dysfunction, personal distress, and illness. But those things are good. After all, most people encounter such problems at some point in their lives, but we would certainly not call them disturbed because of it. Because like I said, we all experience depression, sadness, anxiety, and it doesn't mean that that's the way you're going to permanently be. Some of it is situational, and when that situation resolves itself or you come out of it, then that stops. We agree with the theorists who say that in very general terms, good mental health consists of two elements. Number one, the ability to face and cope with our own limitations in meeting the demands of everyday life. And like I said, I've had to come to terms with that and cope. I'm not a fan, but it is my reality. And I've had to come to accept that and move on with what I can do. Number two, a positive attitude toward ourselves and the world at large. And that's someone made a comment one time that I'm on myself, and it's like, no, I'm not. I just know where I came from and where I'm at now, and I'm very happy that I did that for myself, that I loved myself enough to do that for myself, because nobody else was sure doing that for me. And the world at large is not so bad. Our country's kind of got some problems right now, and I'm hoping that resolves itself in the next election. These two elements are not all we need to keep us afloat during bad times, but they do help. But they can go a long way in helping us maintain a peaceful sense of inner balance. Abnormal behavior is behavior that is markedly different from the behavior of most people in society. In addition, it impairs the individual's ability to function normally, and that's a tell right there. Does your problem stop you from functioning normally? And is disturbing to others? Is it disturbing to others? Now, if you grow up or hang around with a bunch of negative, critical people, that might just be them. That might not be that your behavior really is that disturbing to others. You might get out around other people who don't have a problem with the way you are. And then you start to see, you go, things that make you go home. Behaviors considered to be abnormal are usually maladaptive for the survival of the individual. So again, something that goes against your survival, and often for the society in general, and something that goes against that. So again, a danger to yourself or others. Through the process of socialization, we learn our society's norms or standards of behavior. Because you raise your kids, hopefully, to be people. Like I said, I tried to raise mine to be good people, intelligent, thoughtful people, loving, compassionate, understanding people, and decent people. And hopefully that's the way you were raised, and you should raise your kids, which help us differentiate between what our culture says is normal and abnormal. And like I said, there are as many cultures as there are areas on the map, and each culture is different. Some cultures value things some way and some another, and when you start getting into that, you can't really start saying that things are bad or good, but they can be things that are not good for people or society as a whole. So those are things to look at. The name we give to the people who have mental problems affects the way society responds to and treats those people. So be careful about how you label people, because you'll give impressions to people, and that might not necessarily be good. But you can also warn people about people if you know there's some danger there. In turn, the way society feels about the issue affects the afflicted person's self-image, because if everybody's going to say, oh, she's, and then you're going to feel like, well, okay, whatever, I'm not, but they're all saying I am, so maybe they're seeing something I'm not seeing, I don't know. And can greatly influence the course of recovery, because again, if you feel like there's a lot of negative and critical input coming in, then you're going to feel like, well, I guess this is just it. And even eventual rehabilitation and acceptance into mainstream society, and that is the goal. For anyone who can be rehabilitated and put back into mainstream society, that is the goal. Now, everyone can't be. There are people who have severe problems, and they can't be. And they don't need to be, because they're a danger to themselves and others. Although we prefer the psychological model of defining abnormal behavior, other models have been cited: the statistical, the biological, the disease, and the absolute. Currently, the disease model has a great deal of influence on how society treats mental problems, because it is labeled as diseases, mental illnesses, not as the person's crazy, or they have a problem like eating disorder or alcoholism, which are considered treatable diseases. So it has helped in the viewpoint of society towards mental illness. However, this and all the other models have major limitations because, again, one size don't fit all. The field of abnormal psychology, which developed from all these different approaches, attempts to define, describe, explain, and manage the various forms of psychopathology. And that is the goal, to identify, okay, this is what's happening, here's what we're seeing, and then, to say, okay, let's get to the root of this. Why is this happening? What's going on here that is causing this, and then to manage the thing, whether it be to manage the illness, manage the symptoms, manage the brain chemistry, whatever the problem is. That is the goal, is to treat people, and that's why psychology was even invented. So I'm going to leave you there for today. I hope that help you figure out. My tongue is bad today, as you've noticed. It's like 90 degrees, so that's probably why I don't do heat very well. But hope that helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program, and that's what it is, an educational program. It's not designed to diagnose or treat any mental illnesses. If anything I said during this program has triggered you, or you feel like maybe something I talked about is relevant to you, then by all means go talk to your mental health professional. Excuse me. My goodness. Oh my gosh. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. Thanks for watching or listening. That's all for now. Until next time. I'm trying to not cough, but it's not working, is it?